The first stereo Q&A I did with Dr. Tina Pierce went down very well, and it kind of seemed like we could have kept on answering and fielding questions for hours. So when I was presented with the opportunity to do another one on the subject, I jumped at the chance. This time I'm going to be talking to Dr. Tamsin Lewis, nutritional and functional medicine specialist, about long COVID. Dr. Lewis is a sufferer herself, so has an extremely rare perspective on the condition, that of both clinician and patient. We'll cover some of the hot topics in terms of treatment and management, including intermittent fasting, hyperbaric oxygen treatments, and just what the role of activity might play in recovery. And it's a great pleasure again to state that this particular film is sponsored by Stereo, an interactive live talking app that enables the audience to partake in the discussion. Just so you can see how it works, here's a short clip from my previous show with Dr. Pierce.
And I think Dr. Affan was saying how he'd love to see a future where you can test someone's genetics, and you can do sort of a blood test and a urine test, and you can work out exactly which drugs will work without having to go through this whole process. I don't know how far away that future is. All right, we've got the questions are piling up. Let's go again.
How important is it to have an actual diagnosis? For example, here in Scotland, I'm not aware of any specialists in the area. Am I better just going ahead and trying to identify something that works for me, or should I press on and try and get some sort of medical advice around it?
It's a very good question. I would press on and try and work out what works for you, because there's nothing to stop you doing that. As I say, if you're on any medication or you have any other comorbidities, other illnesses, please talk to your GP before you start trying different things out. But in the main, I would absolutely get on with trying to get over the counter type 1 antihistamines, lower the histamines in your diet. And some patients find that taking a non-steroidal anti-inflammatory is really helpful. So ibuprofen 400 milligrams 3 times a day after food, that sort of thing. So you could try some of these things, which are a sort of self-help, if you like. The problem is that so few doctors know or have heard about it. And whilst they want to help, they may not be feel knowledgeable enough or confident enough to start prescribing you things. So I think at the moment I would press on. And I've had quite a large number of people get back to me and say that even just changing their diet and taking type 1 antihistamines has changed things dramatically for them.
There's a link in the description to download the app. It's completely free, available on iOS and Android, and is a doddle to use. So click on the link and join us on Thursday at 5 p.m. GMT or 12 p.m. Eastern Standard.